Fractures may happen in patients due to osteoporosis, in which your bones begin thinning as you age. Having a bone health assessment is important to understand the quality of your bones and to see if further treatment is needed to prevent a potential fracture. Bone density decreases with age, and postmenopausal women are more likely to experience bone fractures due to decreased estrogen levels. Other risk factors include a family history of osteoporosis, low body weight, smoking, high alcohol consumption, and a sedentary lifestyle.
Managing these risk factors is important to prevent fractures and maintain bone health. Regular bone density scans can help monitor the health of your bones and identify any potential issues early on. Weight-bearing exercises and resistance exercises can help support your bones, along with a calcium-rich diet and supplements. The National Osteoporosis Foundation recommends at least 1,000 milligrams of calcium per day. Speak with your medical team or dietitian to make sure you're getting enough nutrients on a daily basis from food and supplements. Avoid smoking and limit alcohol consumption to promote overall bone health and healing.
If a fracture does occur, your primary care physician or your metabolic bone specialist should be able to treat and manage your fracture depending on severity. When someone has an osteoporosis diagnosis, spontaneous fractures may occur. Fractures may also occur from a fall or losing one's balance from a standing height. Appropriate treatment is important for proper healing and to reduce the risk of future fractures. A bone density test will be done to establish a baseline and keep track of changes. Follow up regularly with your physician or metabolic bone specialist to help your body recover safely and efficiently after a fracture.